understand. And what I'd like to really talk about today is liver cancer, and then finish off with, starting off with a little bit about epidemiology, and then how we treat liver cancer currently. So starting off at the beginning, what am I going to talk about? I think it's very important because many patients get liver cancer. They don't know why they get liver cancer. So I'm going to talk about a little bit about liver disease and liver cancer and the causes thereof, a little bit about the symptoms and signs of liver disease and liver cancer. Then unfortunately, I will have to bore you with some statistics, and then talk about surveillance and prevention, diagnosis, and really finish off with the importance of advocacy in managing liver cancer. So just to start off in terms of the liver, I have had patients who pointed to the left side of the abdomen and said, is my liver here? So just to reiterate, the liver sits on the right side of the body, and it is one of the largest organs in the body. It's about 1.2 to 1.5 kilograms in weight. And it is the largest if you don't think of your skin and adipose or fat tissue as being an organ. But of the solid organs in the body, it is the largest. And you can see that the gallbladder sits under the liver, and it's on the right side of the abdomen. So why do we get liver disease and why do we get liver cancer? I think the concept to understand is that any organ, it doesn't matter whether it's your liver or your skin or your brain or your heart, when you get a disease or damage, and the best analogy I try to use is if someone cuts their hand, takes a knife and cuts their hand, the first thing that happens is you get swelling, which in medical jargon is inflammation. And lo and behold, if you look at that same wound 6 months later, you've got a scar tissue. And so the normal response to injury of any tissue in the body, swelling or inflammation, and then scarring of the liver. Here's a normal liver, and it doesn't matter what you inflame it with. It could be hepatitis B, it could be hepatitis C, it could be alcohol-related liver disease or something rarer, or it could be fatty liver disease. And many of you may have heard of it as being NAFLD or non-alcoholic fatty liver disease. But just to bring the new name out there, it's metabolic dysfunction-associated fatty liver disease, because it's due to the epidemics of obesity and diabetes that we see. But any of these diseases eventually causes inflammation or chronic hepatitis. Then over years or decades, we get cirrhosis, in other words, the deposition of scar within the liver. And when your liver is encased in scar tissue, that's when we histologically call it, when we call it under the microscope, cirrhosis. And the perfect soil for the development of liver cancer, and this is a liver cancer out here or here, is a cancer that arises in a cirrhotic liver. So the broad principle is inflammation in the liver gives you swelling, results in scarring, which eventually gets to the stage of cirrhosis, and then cirrhosis is the ground for developing liver cancer. So cirrhosis, as I mentioned, essentially refers to a scarred and a stiff liver. And what most patients don't understand is that once the liver has cirrhosis, you've probably lost about 80 to 85% of its function. At the same time, when you come to clinic and you're told that you've got cirrhosis, you feel perfectly well. You have no symptoms and you feel completely normal. Why is that? And it's very easy to understand if you think that the liver is the central chemical factory in the body that takes in all the food that we eat. It's the first port of call, and then it's distributed all around the body. So if you have an organ that's so central, then we've been created with a huge amount of liver reserve. So your liver can be functioning normally, even though it has lost 80 to 85% of its capacity. Eventually, once you lose the remaining 15%, that's when you get into liver failure or liver cancer. And just to illustrate that in a diagram, this is how long the disease may last in a person. This might be 3 or 4 decades. This is when you feel 100%. Bottom here is when you're nearly dead, or 0 would be when you're dead. And if you think about someone who's got heart disease or lung disease like asthma or a skin disease, as their heart disease gets worse, they get chest pain, and the symptoms closely correlate with how bad your heart function is. Or in the case of asthma, you can't breathe, you'll go immediately to your doctor. And the same thing with a skin disease, you get a rash, you can see it, you immediately go, you get symptoms, it's itchy or whatever, and you go and see your doctor. But liver is very different. So your liver can be destroying itself very, very gradually over decades. But in terms of how a patient feels, they've got no symptoms. And it's usually when they destroy 85 to 90%, they're on the edge of the cliff, and then they crash with developing symptoms of liver failure. And this happens very late in the piece. And so if you go to a less well-resourced country, what you will find is that most patients in liver clinics look sick, they feel sick, and they're all wasted away because they present when they have symptoms. On the other hand, in more affluent countries, patients are picked up because they've got abnormal blood tests when they go to a GP. They're picked up early, they're tested early, and they have no symptoms, and it's entirely normal not to have symptoms. And then if you actually follow the advice we might give you, in a large part, we can preserve liver function, we can prevent the development of liver cancer, or in fact, liver failure. So what symptoms can you get when your liver is failing? And as I mentioned before, these are patients when they've already destroyed their 85% of their liver, but when they destroy their remaining 15 to 20% of their liver, the last 15 to 20%, they develop some symptoms. So you can have a very distended abdomen full of water. This is what medically we call ascites, and you can see this gentleman would look like he's got triplets because that's such a distended abdomen. And the reason you get this distended abdomen is your liver is very scarred, and normally all the blood from your intestine percolates through the liver and gets to your heart. If your liver is very scarred, then the blood cannot percolate through, and so the blood vessels leading to the liver begin to dilate, just like you would have in a dam. That, if you block the dam levels rise and the veins rise. And so sometimes you can see these dilated veins on the abdomen, suggesting that these are, when you can't go through the liver, these veins develop, and this is trying to take the blood to the heart. And so ascites or fluid accumulation happens when these swollen blood vessels just start leaking fluid. And as I said, you can develop veins on the abdomen, but you can also develop these dilated veins in your esophagus. And some of you may have heard of the term varices. And varices are basically Latin for varicose veins. And these are varicose veins exactly like you would see in your leg, happening in the esophagus. These are red and juicy grapes that can rupture and they can bleed. And some patients get these little spots or liver spots that some people call them. They're called spider nevi, and they're essentially blood vessels, and they radiate with like a spider from the center. And if you press one of these, they blanch and they fill from the center to the outside, and they're called spiders or liver spots. And many people with significant liver disease might have these liver spots on their face or on the top of their chest. The last bit is having jaundice or yellow eyes. So those are the symptoms of getting liver failure. So what are the risk factors for liver cancer? So we're moving away from poor function and talking about liver cancer. So the major risk factor for liver cancer, and 80% of liver cancer occurs in the setting of cirrhosis of the liver, very diseased, scarred liver. If you look at some of the causes, it can be hepatitis B or hepatitis C or hepatitis D. Hepatitis D mainly occurs in the western parts of Asia, such as Mongolia, and also in the Middle East. But hepatitis B and C would be a very common cause. Excessive alcohol use can result in cirrhosis and give you liver cancer. Fatty liver disease, or MAFLD, as I mentioned, metabolic dysfunction-associated fatty liver disease, is probably going to become in the next decade the commonest cause for liver cancer. And as I mentioned, you damage your liver over time, and it can take decades. So age is a very important risk factor. Most people with liver cancer, the peak is in their 60s and 70s, but we do have younger people in their 30s and 40s who develop liver cancer. Liver cancer is also 3 times more common in men than in women. And that tells us that it's got something to do with the testosterone that men have and that women don't have. The testosterone is a driver for liver cancer. And that's why it's more frequent in men than in women. And there are certain environmental factors that can predispose to liver cancer. And aflatoxin, I'm just putting it there, it's very rare in the Western world. Aflatoxin is a fungus that grows, or it's a mold that grows on peanuts. It's very common in West Africa, and they store peanuts for a while, and in the Daqing province in China, which is close to Beijing. As soon as they identified aflatoxin, or the mold growing on peanuts, as a cause for liver cancer, they basically had better storage and preventing mold growing, and very quickly aflatoxin-related liver cancer has disappeared. So it's cirrhosis, viral hepatitis, alcohol, and fatty liver. So what does liver cancer look like? So this is your liver, and this is a liver cancer, and it looks different from the normal liver. And liver cancer arises from liver cells, and the technical name for liver cells are hepatocytes. The medical terminology for liver cancer, using the term primary liver cancer or liver cancer is fine, but medically a lot of people call it HCC or hepatocellular cancer. And the reason we actually have it is to say that it's come from the liver, it's come from liver cells. Remember that there are many people who might have lung cancer or breast cancer or prostate cancer that spreads to the liver. That's what we would call primary prostate cancer, for example, with secondary liver cancer that's spread from the prostate. Whereas primary liver cancer comes from hepatocytes. I'm not intending to make you squirmish, but as I mentioned, typically liver cancer, 80% of liver cancer occurs in a scarred cirrhotic liver. So this is a liver that's scarred with cirrhosis. You can see multiple nodules in the liver. These are the nodules of liver cells, and all the stuff in between these nodules is scar tissue. It's exactly the same as the scar tissue you see when you cut yourself, and you get a scar tissue a few months later. And then the green here is a liver cancer. And you can see here's another liver cancer there. The nodules in the liver are very small. Here's another one. Here's another one in a surgical specimen when you cut it open. And most of it surrounding liver, as you can see, has got cirrhosis in it. That's 80% of liver cancer. But a minority of liver cancer, maybe about 1 in 5 to 1 in 10 liver cancers that we can see, can occur in a minimally scarred liver. So it's just in the phase of inflammation, and that's when you can develop liver cancer. Here You can see this liver as opposed to the previous one. It's completely normal in terms of looking at the surface. It's very smooth and it's brown, as opposed to this liver that looks so irregular and very nodular. This is very smooth, and this is a cut surface of a normal liver. And you can see it looks really very, very smooth. And here's a liver cancer. Here's a bigger liver cancer. 80 to 90% occur in a scarred liver. About 10 to 20% can unfortunately occur in a normal liver. The best way to prevent both of these is to, if you've been diagnosed with liver disease, go and see your primary care physician or your general practitioner and get the treatment or the monitoring that's required to prevent liver cancer. So what are the symptoms of liver cancer? Now, most people with liver cancer, you detect it early. In other words, you've got some form of liver disease that your GP has detected. He puts you into a surveillance program or screening program. Then you should be able to identify a cancer if it unfortunately develops before you have any symptoms or any signs of liver cancer. In other words, you get them when they're so small that we can treat them. To get symptoms from liver cancer, it's usually quite late. And if a patient presents with symptoms from liver cancer, many times it means that it's quite a large cancer. So the symptoms you can get include weight loss, loss of appetite, a bit of discomfort on the right side of the abdomen, nausea, weakness and fatigue. You can get abdominal swelling with liver cancer. You might get jaundice. And sometimes a liver cancer can present with an itch, but that's not very common. And to explain why these patients can develop symptoms late, I've had patients presenting with an 18-centimeter liver cancer. Until a month ago, they've not had any symptoms whatsoever. So the key message here with liver cancer is if you've got liver disease, get yourself monitored so that we don't, and if you're going to develop liver cancer, we can diagnose it early before you develop any of these symptoms at a time when we can actually treat it. So this is really just trying to highlight some of the numbers. And look, I won't bore you with numbers, but just to highlight that in the, this is the World Health Organization data. In 2012, there were 14 million cancer cases and 780,000 patients with liver cancer. In 2020, we had about 18 million cancers in total, but liver cancer had jumped from 782,000 to 900,000 cancers. So probably 1 million people in the world develop liver cancer, and our numbers are increasing. And when you also look at mortality, this is in 2012, and you can see in 2012, there was 8 million deaths with liver cancer. In 2020, there were 9 million cases, 9,950,000 cases with liver cancer. And what it suggests is that the WHO currently estimates that there'll be more than 1 million patients who will die from liver cancer in 2020. So it is an epidemic that we're facing because of the diseases that cause it: hepatitis B, hepatitis C, fatty liver disease, and alcohol. The other important thing to note is this issue of what we call incidence mortality ratio. In other words, in the blue is the number of cancers that occur every year, and then in the red is the number of people that die from that cancer. So you can see in the whole world, there were about 15 million cases, new cancers diagnosed in 2012. And you can see that there was about 7 million people that died from the liver cancer. So that mortality incidence ratio is about 0.58. In 2020, you can see that had decreased. What that means is that if you look at all cancers, more people, yes, there are more people diagnosed with liver cancer, but more of them are surviving, okay? So the mortality has decreased. So if you look at breast cancer, for example, if you are diagnosed with breast cancer today, the chance that you will be alive in 5 years is 95%, because we've got good curative treatments. As opposed to that, when you look at liver cancer, the incidence ratio is, smaller numbers, 800,000, but the mortality, virtually for every one person that's diagnosed, one person will die from liver cancer. So what that is telling us, and you can see that number hasn't changed between 2012 and 2020. And what that's telling us is that liver cancer is where breast cancer, prostate cancer, and bowel cancer was 30 years ago. And we need to do something. And it's all the patients and the consumer groups and the advocates that have to push for research so that we can actually improve liver cancer outcomes. Because we can get it to where breast cancer is today or prostate cancer is. The majority of people can have meaningful life after a diagnosis. And this is also looking at outcomes. And these are some of the other cancers that people would know about: thyroid cancer, kidney cancer, melanoma. And you can see that the survival at 5 years is very good. And completely different to that is liver cancer at the bottom here. So we need to change the narrative of what's happening with liver cancer. We can't have it stuck in the doldrums of the 1970s. We need to get treatment and cures up there to benefit the patients that we have. And this is really just looking at it for Australia. I won't go into it in great detail, but you can see the cancer incidence is increasing in men and women. The mortality is increasing. And then if you look at age groups, this is a disease mainly of the 60 plus brackets, because that's how long it takes for you to get the liver damage. And then the last bit of statistics I would like to show you is looking at the number of, the rates of different cancers in terms of their growth. You can see all these common cancers have decreased in incidence in 1982 and 2019, bowel cancer, lung cancer, ovarian cancer. But you can see liver cancer has increased 378%, in other words, fourfold. And if you look at mortality here on the right-hand side, liver cancer mortality has increased, but most cancers have decreased. And even with melanoma, the risk is much lower than it was 20 years ago. So we need to do something about liver cancer. Now, that's all I'm going to actually bore you in terms of the statistics. But in terms of how do we prevent liver cancer, the most effective treatment for liver cancer is to prevent it. If you've got hepatitis C, we've got good drugs now to cure it. If you've got hepatitis B, we can suppress the virus and reduce liver cancer. With alcohol, you can reduce harmful alcohol consumption. And if you've got fatty liver from diabetes or excess weight or lack of physical activity, we can do something about it. If you've got significant liver disease already, your GP might put you into a surveillance program, in other words, a screening program. Many of the women in the audience will know that for breast cancer, we screen every 2 years. Liver cancer grows quicker than that. So the screening that we do for liver cancer, unfortunately, is every 6 months. So we would screen any patient with cirrhosis, whatever the cause, we would put them into a screening program. And then with hepatitis B, because hepatitis B can result in liver cancer without cirrhosis in some people, we also screen people at a particular age. So men over the age of 40, women over the age of 50, people from sub-Saharan Africa over the age of 20, and Indigenous Australians after the age of 50. So the take-home message from here is treat the underlying disease if you can. If you need screening, if you're cirrhotic, you need screening. If you're not cirrhotic and you've got hepatitis B, we have some age-based guidelines.